Multidisciplinary approach is the best thing. That's what I'm saying. Actually, whenever I'm talking a board annapudamma, it's a multidisciplinary board meeting. So all the concerned specialities sit together and decide what is best. We have a radiologist to read us the thing actually. We have the gastroenterologist, we have the general surgeons, we have the pathologist. అందరు కూర్చొని డిసైడ్ చేయాలన్నది. So it's a multidisciplinary approach. And likewise, we have, this is for benign diseases. Cancer, we have a tumor board. Then at the end of the day, we give an AIG tumor board decision. You understand, ma? It is not my decision. It's a tumor board decision where everybody is sitting involved. We tell them this is the best option available. That you can take it anywhere. My decision is black and white. It's a tumor board decision. It's black and white.
Right.
I mean, if you don't want to follow that, that's your this thing. And I cannot, it is now current practice, I cannot say that I want to do this actually. It has to, we have to do some evidence-based practice. What is there? What is the standard of practice?
జనరల్గా మీ సర్జన్స్ మీ హెల్త్ కోసం ఏమైనా ఇన్ఫెక్షన్స్ వచ్చాయేమో, ఎక్కడైనా పొరపాటున మనకు ఆ బ్లడ్ కనెక్ట్ అయిందేమో, లేదా ఇన్ఫెక్షన్స్ ఏమైనా చెక్ చేసుకోవడానికి మీరేం టెస్ట్లు ఎంత కాలానికి ఒకసారి చేయించుకుంటూ ఉంటారు సార్?
యాజ్ అ రొటీన్ మా యాక్చువల్లీ ఇయర్లీ వీ గో త్రూ ద చెకప్స్, ఇయర్లీ వన్స్ ఒకసారి చెక్ చేసుకుంటారు. బట్ వెన్ ఎవర్ వీ ఫీల్ దట్ ఏదైనా pricks, and obviously I cannot deny any patient surgery on any reason. We have to operate patients on hepatitis B, we have to operate patients with HIV. I mean, these are all, we cannot deny any patient right now. So we take our own precautions. But whenever we have, I mean, any needle pokes, anything of that sort, then obviously we have to take immediately, we have a system wherein we have to report to the concerned department. That concerned department tells us what to do, what precautions we have to take. Vaccination, we make sure everybody is vaccinated for all the things actually.
Right.
And yearly flu vaccination, flu vaccines, and we try to protect them as much as possible, suggest them. But again, there will be some people who are non-believers in vaccines. See, this is there everywhere. So they'll say, so that is there actually. Some people believe.
మీరు నమ్ముతారా వ్యాక్సినేషన్ సిస్టమ్ని?
I believe.
ఎందుకంటే పోలియో అలాగే ఎరాడికేట్ చేశాం కదా.
Yeah, I believe in vaccines actually. But umpty number of theories ఉండొచ్చు. ఇప్పుడు it all depends on now. ఇప్పుడు ఏ సిమ్టమ్ వచ్చినా కానీ కోవిడ్ రిలేటెడ్ వ్యాక్సిన్ అంటే కష్టం తెలియదు. That is difficult.
COVID is something different than other vaccinations kada.
Vaccine is it's a must actually. It's a tested thing that is shown to prevent the thing. So
అవును. ఇప్పుడు నేను ఎక్కువ సొసైటీలో చూస్తుంది ఏంటంటే సార్, హెపటైటిస్ A, B, C అండ్ E కూడా. సో టోటల్గా హెపటైటిస్ ఏ సెక్షన్లో ఉన్నా కూడా మనకి వ్యాక్సినేషన్ ఒకటే ఉంటుందా సార్, లేకపోతే డిఫరెంట్
అన్ని వ్యాక్సిన్ వేరమ్మది. హెపటైటిస్ బి వ్యాక్సిన్ వేరు, దీని వ్యాక్సిన్ వేరేస్ ఉంటాయమ్మా.
ఇస్ దర్ ఎనీ ఏజ్ లిమిటేషన్స్ ఫర్ దట్ సార్?
లేదమ్మా, వ్యాక్సినేషన్ ఏం లేదు. హెపటైటిస్ బి వి యూజువల్లీ అడ్వైజ్ యాక్చువల్లీ ఫర్ ఎవ్రీబడి యాక్చువల్లీ రైట్ నౌ. సో ఇట్ ఈస్ యూనివర్సల్లీ
లిమిట్ లేదా అది?
లేదమ్మా, దానికి ఏం లేదు.
ఏ ఏజ్ లో ఉన్న వాళ్ళైనా
తీసుకోవచ్చు. నౌ దట్ యాక్చువల్లీ మోస్ట్ ఆఫ్ ద చిల్డ్రన్ నౌ ఆర్ బీయింగ్ వ్యాక్సినేటెడ్ అట్ ఎర్లీ ఏజ్ రైట్ నౌ. ద అదర్ థింగ్ దట్ హస్ చేంజ్డ్ ఈస్ యాక్చువల్లీ నౌ artificial intelligence. It has come into every aspect of life now. And whether you like it or not, actually it's part and parcel of the life actually. Whether it will replace, and there is an apprehension that doctors replace.
Me doctors kuda replace chestundi enti. Is it possible like that? I don't think so, sir.
No, actually I'll tell you now, just yesterday we installed one software in the hospital wherein all the x-rays that are coming actually to pick up things which are not picked up by even conventional this thing actually now. So there's software which is going to detect any link lesions on routine x-ray, on routine CT. Yes,
right.
Yeah, we have put it up actually. I mean, it does not mean that we are putting the whole thing through artificial intelligence, but we are taking the help of artificial intelligence to detect. We don't want to miss even this thing actually.
Minute point kuda miss
minute point actually, and it is helping us in a lot of other ways. Actually, initially ఏంటంటే medicine was based on equations. Now medicine slowly changing to algorithms. So there is change, and it is definitely helping us in making some good decisions, picking up things which you have not seen. So these are the things that actually, but argument for and against untundamma idi. But ultimately, whether you like it or not, you got used to cell phone.
Yes.
Whether you like it or not, actually you have forgotten the spellings of lot of things.
అవునండి.
Yeah.
Absolutely. మన వాయిస్ తో చెప్తుంటే టైపింగ్ చేసుకుంటూ
వెళ్ళిపోతాం. So you forget. Now you want to write, you cannot write actually. So like this actually subconsciously this is slowly getting into the thing. So we have to, again, artificial intelligence depends on how we feed. So obviously we should be better in feeding the right content to the thing so that we get, we started a new department of artificial intelligence here actually. Yeah. We have 6 projects already which we have done very successfully.
అంటే సర్జరీలో అయితే మీరు రోబోటిక్స్ సపోర్ట్ తీసుకుంటున్నారని తెలుసు, బట్ ఆర్టిఫిషియల్ ఇంటెలిజెన్స్ మీకు సర్జరీలో ఎలా ఉపయోగపడుతుంది?
Very good question right now. Actually, what happens initially, it is now these images right now. We ultimately we called it as navigation surgery, where everything is put onto the thing and superimposed during surgery. It is like having a Google map in the theater. It will tell me point A to point B how to go, which is the safest route, how to minimize the blood loss, where is the tumor. It will tell us everything right now.
ఇప్పుడు ఏమైనా ఆర్టిఫిషియల్ ఇంటెలిజెన్స్ గురించి తెలుసుకున్నప్పుడు అది చెప్తుంది, కానీ కొన్ని పాయింట్స్ మిస్ అయ్యే అవకాశం ఉంది అని అనుకుంటాం.
It guides. It just guides.
ఎగ్జాక్ట్లీ. సో దాన్ని కూడా మీరు సెగ్రిగేట్ చేసుకుని వెదర్ వీ కెన్ డూ ఇట్ ఆర్ నాట్, ఇంతకన్నా ఇంకేమైనా పాయింట్స్ ఉన్నాయా మిస్
Yes, these are all this thing done actually. These are all done actually to an extent that we have every single thing right. ఇంతకుముందు ఈ కాటరీ మిషన్ అనేవాళ్ళు కట్ చేసేది. Now we have all, these are called all intelligent energy sources. అది ఎంత కట్ చేయాలో అంతే కట్ చేస్తుంది.
ఓకే.
These are all intelligent machines actually. It calculates and cuts actually. You cannot, దానికంటే ఎక్కువ ప్రెస్ చేసినా కట్ చేయదు, అంతే దాని పని చేసి అంతే చేస్తుంది అది.
రైట్.
So these are all intelligent quarters, intelligent staplers and say. The best thing that actually, we believe it or not, what has happened, we are robotics is taking help actually. So, but outside people think it is robotics, is robo is doing the procedure. But that will come true because the first experiment was already done where the entire surgery was done on a computer. Make sure that you're not deviated from everything, all complications avoided, and then let the computer do the procedure.
Right.
The first animal work is done actually. Slowly it will come. Because you're asking me the same thing actually, routine surgery errors ఉండవా అంటారు ఇప్పుడు.
అదొకటి నాకు ఇప్పుడు ఇంకొకటి మైండ్లో మీతో మాట్లాడుతుంటే వచ్చింది ఏంటంటే, ఇన్ కేస్ అదే జరిగిపోతే డాక్టర్స్కి ప్రాక్టీస్ అనేది తగ్గిపోతుంది.
You're practicing on the system కదా. You're doing it as a system. You're not allowing the system to. You're doing it as a system.
Patient తో ప్రాక్టీస్ వేరు, సిస్టమ్ తో ప్రాక్టీస్
But
వేరు.
you're there, I mean, you're there on the system actually. You're doing it. I mean, it's like doing a live surgery only.
Right.
There is no difference between doing it on the thing. Same, it look the same image. It will look actually. There is no difference actually.
సో మనుషులతో మాట్లాడడం మానేసి సిస్టమ్ తోనే మాట్లాడతామేమో సార్ మనం.
That may be different, but it will come. Artificial intelligence is going to play a big role. మా దగ్గర recently we got actually one medical robo we started 6 weeks back actually.
Okay.
Just out of curiosity, we wanted to see how it informs actually. So we got a medical Mira and Betam, then medical integrated robot.
Okay.
So we used it in the recent conference actually. So initially ఏంటంటే కాన్ఫరెన్స్ టైంలో అంత the patient data used to be given by doctors.
Okay.
Junior doctors చదివేవాళ్ళు before we do the procedure on the screen.
అవునా, వీడియో ఉందా సార్ అది?
We have the video of the
ప్లీజ్
thing.
ఉంటే నాకు కూడా
So
ప్రొవైడ్
this time,
ఉంటే మాకు పరిచయం చేస్తానన్నా కూడా ఓకే.
we'll take you to the AI department actually.
Right.
So what happened was this time we let the Mira do the reading.
ఓహో.
So the doctors, they thought they're losing the screen time.
ఓకే.
It is their opportunity to go onto the big screen. So they're losing the screen time. But when we see from the other perspective, ఇప్పుడు మీరు when you're shooting the thing, you're worried about your angles, you're worried about movement, this and that actually. So we, from the perspective of the audience, we feel that all those unnecessary movements are avoided, unnecessary expressions are avoided on the screen.
Okay.
Which could sometimes negate the routine this thing actually.
Right.
So that is the perception. See, routine is, suppose you like, I mean, suddenly you come onto the screen, you're a professional anchor, you can talk whatever, you can change your expressions to whatever you want. But I can't do that actually.
Get it.
So what happens is, so when we people do it actually, some of the expressions when you're shown in a big screen may not look good.
Right.
So when you do this, actually it's uniform. So you like, and it is integrated. It is giving solutions also for us actually. Though we don't depend on it, but it is giving solutions for us right now.